Hello, this is Margie Meady, and I'm recording the PowerPoint Crisis Intervention. And we know that any stressful situation can precipitate a crisis. So often nurses have to be able to provide assistance with problem solving during a crisis period in order to help the client or groups of clients preserve their self-esteem or to promote their growth with resolving that crisis. So what we're going to talk about in this PowerPoint is the concept of crisis and the therapy of crisis intervention, and of course then the role of the nurse in crisis intervention. So this slide just gives you the definition of a crisis, which is a sudden event in somebody's life that disturbs their homeostasis. And it disturbs it to the point where the usual coping mechanisms are not able to resolve the problem. So again, the criteria here are sudden event and homeostasis disruption, and the fact that typical coping mechanisms don't achieve that balance that normally can occur when somebody is dealing with just normal everyday stressors. So characteristics: everybody at one point in their life is going to experience a crisis, and it's not necessarily equated with psychopathology. So in other words, people can overcome a crisis and not have any residual detrimental effects, but of course sometimes a crisis can lead to psychopathology. Crises are precipitated by a specific identifiable event. In other words, it can be pinpointed, traced back to a certain event that precipitated or was the initiation of that problem. And they're personal by nature, so what's a crisis to one person is not necessarily a crisis to another. Of course, there are some universal crises, a catastrophic event, environmental event, for example, a hurricane or earthquake, something like that could be experienced by a collective group of individuals, but it might not be a crisis for one person in that group because they have no damage to their personal property, they didn't have any loss of anything, where it could be a catastrophic loss for somebody else in that same community. So they're acute, not chronic. That means they happen, at a specific time, not an ongoing type of situation, and they either get resolved one way or another after this brief period of being exposed to the crisis. A crisis situation contains the potential for psychological growth or deterioration. So it can go one way or the other. You see in this picture here, this person is overcoming the crisis, going around it and getting back to a straight line on the other end, whereas they could get detoured and not be able to overcome the crisis. And so it could happen either way. So this slide goes over the phases that develop in a crisis. So first, the individual is exposed to a precipitating stressor. If they're able to relieve the stressor, things are fine. But if they are not able to relieve the stressor, then they have an increase in their anxiety. When they're exposed to this stressor and trying to deal with this crisis, they utilize all their internal and external resources in order to try to resolve the problem and relieve the discomfort they're feeling from the crisis. So they use their coping skills, and then they use their support mechanisms, and if they're effective, then great. If they're not, then we have more problems. So if resolution does not occur in those first three phases, those previous phases, the tension will continue to mount beyond a point, a threshold where a person gets to a breaking point, and then there's major disorganization of their coping skills, and then they have often drastic results. So whether an individual that's experiencing a crisis is able to respond successfully to the stressful situation depends on how they perceive the event, how much support they have, situational supports, and whether they're able to utilize their coping mechanisms adequately that they've utilized in the past. So again, the perception of the event. An example I can give is, let's say you have a loss of a close family member, but that person didn't perceive that family member's loss as having a great impact on their life. So one other person might have the loss of the same relationship in their life. Maybe it's the loss of a parent, and one individual didn't feel that as significant of a loss because they had their own life separate from their parent, and while they might have felt some sadness over the loss, it didn't impact their daily life, whereas another person who felt so connected to that parent that they felt that it was a major upheaval in their daily life, that their perceptions are completely different of the same event. The availability of situational supports, people that have supports in place that they can rely on and depend on when they need help, impacts whether or not they can be successful in adapting, and whether or not they can call upon their coping mechanisms to deal with this crisis, and whether they're adequate to deal with it or not. All of these things determine whether somebody's going to be successful in adapting to this stressful situation or not. So these are the types of crises that people can be exposed to. A dispositional crisis is an acute response to an external situational stressor. In other words, it's a specific event, a specific situation that has occurred and that they have to respond to. I kind of gave the examples of an environmental situation that occurs and they have to respond to that particular situation, or the loss of a family member. It's a specific situation that they have to be able to adjust and deal with. It could be the fact that they're trying to anticipate a transition in their life. It's just a normal life cycle transition, and they may anticipate that, but they still may feel a lack of control over it. So again, I gave the example of the loss of a parent. I mean, we all know that many of us are exposed to that particular life transition. Some of us have, a bigger impact on our lives than others from those same things. It could be that the crisis results from a traumatic stress, where there's this significant unexpected external stressor and the individual has little or no control over it, and they feel emotionally overwhelmed and defeated. So you can come up with all kinds of examples of these things. Again, it's personal perception. Let's say it's the loss of a job that comes completely out of the blue. I mean, a lot of people right now are dealing with loss of jobs from COVID, and that's a crisis that's completely out of a person's control. And so whether or not somebody feels that this is a very traumatic situation, it could be an example of that. Maturational or developmental crisis, again, it's responding to a situation that triggers emotions beyond their ability to deal with a conflict that was unresolved in their life. So maturational developmental could be a child that's not able to become independent. When they become an adult, they can't move from adolescence to, the normal stage to become a self-reliant adult. So they might have a crisis because they can't find a job and become, independently self-sufficient. Crisis relating to psychopathology. This is when someone has an emotional crisis because they have an underlying psychopathology, a diagnosis that precipitates a problem that impairs their ability to adapt. So they might have an exacerbation of their symptoms, or they might have some event that triggers their symptoms to become unmanageable again. A psychiatric emergency is when general functioning is severely impaired. The individual cannot compensate at all. They're rendered incompetent and unable to assume personal responsibility, and then we need to take over and assume care for them because they are unable to function independently. So they've decompensated to the point where they're unable to provide their own care, their own self-care. So what is crisis intervention? At the minimum, it's the goal of helping someone to resolve the crisis by restoring them to a level of function that existed before the crisis period. So you help them with their psychological adjustment to deal with that immediate crisis, and then they go back to their functioning level that existed before this crisis intervened with their life. The maximum goal is to improve the way they were functioning above the pre-crisis level. In other words, they had a level of growth because of this crisis, and the crisis intervention allowed them actually to have some self-growth from the way that they were able to deal with this crisis and learn from it. So the therapist's role is direct, supportive, and that of an active participant. And the nurse may be called on to function as crisis helpers in virtually any setting that you practice in nursing. So there could be nurses are involved in crisis intervention on very personal levels with specific patients. They're involved in crisis intervention for communities, crisis intervention for groups of people that they work with. And so nurses have a very active role in crisis intervention. So this slide goes through the different phases of crisis intervention and the role of the nurse in those different phases. You know that we talk about this very often, the different phases of the group development and all of those types of developmental strategies that are involved with these kinds of nursing roles is a big part of this course. So in the beginning phase of crisis intervention, the nurse is assessing the situation. She's gathering or he's gathering information about what caused this stressor and what's the reason that the person is now seeking professional help. So gathering details about what precipitated this crisis in this person's life. Then they plan the therapeutic interventions. The nurse will select a nursing diagnosis that reflects the immediacy of the crisis intervention, and the desired outcome criteria will be established, and then the nursing actions are selected, keeping in mind the type of crisis and the previous ability of the patient or client to utilize their available resources and their previous coping strategies, utilize their strengths. And the intervention, the actions are going to be identified, and the planning phase is being implemented, and a reality-oriented approach is used, in other words, to make things be achievable. Working relationship is established very quickly in a crisis situation, and usually it requires unconditional acceptance because it's, an emergency situation. So a nurse needs to be completely accepting of what's going on with this person, utilize active listening skills, and attending to immediate needs because, again, it's a crisis, and so it requires a little bit amped up interventions and approaches. A problem-solving model can become a basis for change. As I said, the minimum is that we could get back to the client's baseline, but the best result would be that we could utilize this crisis as an opportunity to facilitate the growth of a client to achieve a higher level of functioning. So then there's evaluation of whether or not the crisis was resolved, and anticipatory planning where there's a reassessment conducted to see if the objectives were achieved, and a plan of action is developed if the individual needs to deal with a stressor again in the future, or a similar one in the future. So disaster nursing is a specific kind of crisis. It's where a natural disaster of some kind, or natural or man-made disaster, can overwhelm a local community and threaten the function and safety of an entire location, a group of people. Disasters leave victims with a damaged sense of safety and well-being, and there's varying amounts of emotional trauma. As I said, you've seen situations on the news where a hurricane comes through or a tornado comes through, and 3 out of 4 houses are ruined, but a quarter of the houses are standing. So there's different amounts of damage that are occurring to those different individuals. Somebody might lose a family member in a situation, a crisis, disaster like this, and somebody else just feels grateful that, they might have lost their house, but their family members are intact and safe and nobody got hurt. So disaster nursing is something that a lot of people will be involved in, especially those of us that remain in Alaska or live and work in Alaska. We often live in communities that deal with potentials for natural disasters. We had a tsunami warning just last week here in Kodiak, and everybody had to go to higher ground. And luckily, we did not have a tsunami as a result of that earthquake that happened out in the Aleutians, but there was the potential for it. So all of us are in this community ready to respond in these types of situations and participate in what would happen in disaster nursing. There's a nurse alert system that when you graduate you could join that asks for people to be able to move or respond to other locations in the state if a disaster were to occur. So they'd let you know, we have a disaster in this location in the state? Are you able to respond and go there? Can we send you there to help in this emergency situation? So it's an interesting part of the nursing specialty in the nursing profession that some of you, I'm sure, will decide to be involved in your professional career. And this slide gives you an overview of disaster nursing utilizing the nursing process. So again, we do have drills in our local hospital to make sure that we can all, as a group, local group, respond to a disaster should occur. We have these simulations where we have a mock tsunami, mock earthquake, a mock disaster on a cruise ship, a mock any kind of I mean, I could tell you so many more. The students usually participate. We had a mock shooting at the school. It was a disaster drill to simulate that. So in the assessment part, we realized that grieving is a natural response. We all know that the people we're working with in a disaster event are going to have some sort of a grief response. Common behavioral responses to that grieving include anger, disbelief, sadness, anxiety, fear, sleep disturbances, and an increase in substance abuse. So we realize all of those behaviors and responses are possible, and we anticipate, we try to do preventative interventions. We try to even educate that these are normal responses so that they don't, they can utilize effective or more appropriate strategies rather than substance abuse. Children can experience separation anxiety, nightmares, and problems with concentration. And a lot of times people don't realize that they're suffering from these behavioral responses. They think that they've dealt with the disaster or the emergency appropriately, only to discover that they're not able to sleep or they're having trouble with relationships. So the typical types of nursing diagnoses and outcomes that we could have that we could identify in this situation are injury, risk for injury, infection, anxiety, fear, spiritual distress, and then we identify the outcomes that we want to use for criteria for evaluation. And interventions are aimed at maintaining anxiety at a manageable level until this disaster is resolved, encouraging clients to freely express their beliefs and values about their spiritual issues, helping them deal with their emotional reactions in an individually appropriate manner, and promoting activities that improve community functioning. And then again, our evaluations are going to be reassessed to determine if the nursing interventions were successful in achieving our objective of care. So an example question: for the past 3 days, a student has skipped classes, cried constantly, experienced panic attacks, and is now exhibiting difficulty with short-term memory. In her assessment of this student, what crucial information should the nurse initially obtain prior to planning interventions? Go ahead and pause it, think about the options, and then I'll give you the answer. So the correct answer is A. It is important to assess the precipitating stressor that led to the student's behavioral symptoms. This data will be crucial when planning client care. Another example question: 2 students fail their introductory nursing course. 1 student plans to seek tutoring and retake the course next fall. The second student attempts suicide. Which of the following factors would have been influential in the development of the second student's crises? So go ahead and pause it, and then I'll give you the answer. And the correct answer is C. Adequate coping mechanisms can influence the development of a crisis. If a person can draw on past successful coping strategies, a crisis may be diverted. The student had a lack of adequate coping mechanisms. So thank you very much for your time and attention, and I hope you found this lecture and PowerPoint beneficial.